bringing it back now to specific treatments, what is composite bonding? We see it everywhere now. So many celebrities have it. What is it? If I was not a dentist, how would you explain what composite bonding is?
Okay.
So this is our second podcast. Thank you, Kalpesh, for coming. And today we're hopefully going to talk about a little bit about you and your story of how you joined Abbey House Dental, your career, your training, and then really I want to get into smile makeovers. You as a clinician have really focused a lot of your training into smile makeovers, and there's so much to a smile makeover that you can offer that most people that do smile makeovers can't. So really want to get into kind of the pros and cons of certain treatments that you do, and how over the years you've become so experienced at it, and how you've become so well known within kind of Stoke, Stafford, Stone and Rugeley kind of area.
Thank you for having me. So I think my career really started here around 4 to 5 years ago. I remember it was during COVID actually, just after COVID, and it initially started a couple of days a week. I was working at the Birmingham Dental Hospital, and I was also between a couple of private practices there, and I definitely wanted to kind of get better at my cosmetic work. And when I started here, we initially started on a couple of days a week. I was doing a lot of oral surgery because that's my background, so I initially did some consultant-led training at the hospital. So a lot of my work was sedation based, it was oral surgery, and there was some implant work there as well, but it was very kind of complex dentistry. And so when I came here, and when I've been working in private general practice in Staffordshire, I have obviously been able to hone down on my skills, and it's really given me an opportunity to really flourish in that area. So obviously when I first started, it was initially doing like the Invisalign cases, combining them with composite bonding and some of the smaller veneer cases. But then as my reputation increased amongst the local area, obviously then it got busier and busier, and naturally my techniques got better as I started to really invest in my education. So I travelled to America to see Michael Appler, who is almost a celebrity dentist in America and Dubai. I also visited Christian Coachman as well for the digital smile design experience and his kind of workflows there. I even travelled to Turkey to see Galip Viral, who is the pioneer of the veneer technique, the minimally invasive veneer technique.
So you didn't learn how to do turkey teeth?
No turkey teeth there. And I was fortunate enough to also travel to Geneva with some amazing clinicians there, like Didier Diachi.
Wow. So I just wanted to take you back to that first day. I remember it quite clearly when you first joined Abbey House, and it always makes me laugh how you came.
I think I was late.
Yeah, you came late, and I had a big case that I was working on, and you said, "Amit, can I help?" And
Yes.
I was like, yes, go on, help. And you were only meant to come in just to
look at the practice
and see, and you're like, actually, Amit, can I just join in on this case?
Yeah.
And you helped me take out some really difficult teeth. And that you originally, the plan was for you to do 1 day a month.
It was, yeah.
It was 1 day a month, and then after that 1 day with us, you suddenly said to us that you want to start working here at least 2 days a week, and then that quickly went to 3-4 days. What was it about Abbey House Dental and Staffordshire what made you leave the other jobs, and what made you want to stay with us and Staffordshire as a whole?
I think there's a lot of factors which influence that decision. The first thing was obviously it was quite immersive that first day. It was literally meant to be an induction, but I guess I got stuck in straight away because why not? And I think thereafter I really felt at home here. All the staff were very friendly. Everyone was very welcoming. It felt such a great environment to work in, and even patients to this day ask me, "Gosh, you live over an hour away and you travel in. Like, surely, why did you do that?" And I say, look, when I'm here, it just feels so comfortable. The clinic is beautiful. There's very few clinics in the whole of the UK that are anything like this. It's literally like working in the spa. It's very relaxing. The technology is literally at the forefront here. We invest in all the latest equipment, and so as a clinician working in that environment, it just makes sense. The other clinics didn't have that. This offered something new. I could see from your efforts and the practice efforts, the manager speaking to all the members of the team, that everyone is rooting for the patient's care. They're rooting for the success. They're rooting for quality, and that's what I stand by. So those things really resonated with me, and therefore that's why I decided to leave the other roles and reduce the other roles to work in Staffordshire, and obviously now work in Stoke-on-Trent.
Yeah, and taking you back to your clinical journey, you kind of mentioned a lot of the training that you've done, but when you initially joined, you really enjoyed doing kind of surgery, and that was your background, and sedation as well. There were two things that you were kind of, but what made you then, from that background, what made you so excited to do these smile makeovers and really take smile makeovers in Staffordshire to a whole new level?
So you're right, my background was heavily, and not many people know that, was heavily surgery based. So oral surgery, so taking teeth out, wisdom teeth, the real blood and guts that we love as dentists. But that naturally was something that I always have a desire and a love for. But what I also like doing as a general practitioner, as a general dentist, is also the complement to that. So, if you take a tooth out, we want to help the patient with restoring that cap, restoring that confidence, restoring the function, and that lends itself to the restorative side. So that being crown and bridges, the veneers, implant work. So that was something that I always wanted to naturally get into, because that would be the natural path for that patient anyway. So I think I had a natural interest, but also I had at that moment also started to embark on my cosmetic journey by doing more Invisalign cases myself, and in other clinics I was working at, more composite bonding cases. I took it upon myself to go and seek that information and learn about that. And of course, as more and more I did of it, the more I loved it. And I think I'm someone who, as a dentist, some dentists do naturally have a tendency to like a certain treatment, for instance, implants. I think for myself, I've naturally had a liking to quite a variety of things, which is maybe unique to me. But I do know a lot of clinicians who also have a varied skill set.
I kind of disagree. I think you are a hybrid, and there's very few clinicians in the country that have mastered all the different specialities in dentistry like you have. Someone that can do full arch implants to composite bonding to all the veneers that you do. Very few clinicians are talented enough to do that, so I don't know many. Most dentists in our industry can do composite bonding, maybe a little bit of veneer work, but to be able to offer the patient all of the treatment modalities, that's a rare occurrence.
It is quite rare, but in this environment, in Abbey House Dental, I guess we are mentored in a way which allows us to develop all those skill sets. So I think as a clinic, we are unique in the UK, because there's not many clinics like us either, and that's hand in hand with how we work here. A lot of the clinicians do sedation, a lot of the clinicians do smile makeovers, more and more clinicians are placing implants. So I think, yes, I agree that my skill set is quite varied, but also as a clinic, Abbey House Dental is quite unique as well. But going back to your point about the smile makers and what really fills me with that encouragement and ambition is the fact that I get a thrill from them. There's so many cases which I've done, and the reward that you get, you cannot describe it. And you've done it yourself, where you've maybe fitted veneers on a patient who's just been so anxious that first time that they came in, they didn't even sit on the dental chair. They sat on the patient, the guest chair, because they're so anxious of sitting on the dental chair because of their past experience. And what we've been very fortunate to do is transform that experience. We've transformed a nervous patient who had been phobic, dental phobic, to someone who's now really confident, who comes in. They don't necessarily need any sedation now, but to be able to do that, is just very rewarding. It's extremely rewarding, and there's not many jobs that I know of that allow you to do that. And the other thing as well is not only transforming their confidence, but you're breaking down historic barriers that are so ingrained in someone. You know, when someone has a real fear, it's so hard for them to overcome that. Yeah. And you almost as a dentist are acting like a therapist. You're acting like a cognitive behavioural therapist, because your communication is so key to that transformation. It's very rewarding to be able to do that as part of your day job, isn't it?
Yeah. So bringing it back now to specific treatments, what is composite bonding? We see it everywhere now. So many celebrities have it. What is it? If I was not a dentist, how would you explain what composite bonding is?
Okay, so composite bonding, to really make it very simple, it's a tooth-coloured material which we place on top of the tooth, and then we shape it and polish it, make it look glossy, and we then set it with a blue light, and that itself makes the tooth look better in appearance. Therefore, we can change its shape, size, colour, and make a broken tooth look really nice. And often we do this on multiple teeth that people see when they smile, so typically let's say 8 to 10 upper teeth, and that we typically term as a composite veneer because it's laid on top of the entire tooth. Similar to how a contact lens fits on an eye, it covers the front surface. For females, it's like the false nail that sits on the nail. It covers the entire nail, making it look nice. You can choose different colours, different shapes. It's similar to composite bonding.
And so, how long does composite bonding last?
So that's a really good question. Now, typically, when we look at the research, we would say between 3 to 7 years. But I've had patients who have had composite from the very first time that I first placed it, over 7 years ago, still had that composite on. So it still lasted, but from an aesthetic point of view, composite, we know, compared to porcelain or ceramic, does stain faster. It does have the tendency to be a little bit more weak, so therefore it can chip, it can break. But in terms of how long it can last, we often see it last a long time. The main reason as to why patients would tend to upgrade it or refresh it or have it replaced is mainly cosmetics. So mainly it appearing dull, dark, and a little bit tired. So that is the main reason as to why I'd say patients would have their composite bonding replaced.
And so during composite bonding, can anybody have composite bonding, and does it cause any risks to my tooth when I have composite bonding?
So the most important thing with composite bonding, like any cosmetic treatment, is that your teeth and your gums are healthy. So whenever we see a patient, we do a comprehensive assessment, and of course we check gum health, we check tooth health, make sure there's no decay, any problems, and ideally it would be good if your teeth are quite well aligned. And the reason being is when your teeth are aligned, it makes the composite bonding placement really seamless, and it means that the composite can be placed evenly in a uniform layer, which means that the colour and the thickness and the shape is even. If teeth are slightly misaligned, then in most cases we can do composite, but of course we have to skillfully place it so that teeth that maybe be sat back further, we have to layer the composite slightly thicker, so therefore it matches the neighbouring tooth. Now, if your teeth are quite obviously needing some kind of alignment, then generally speaking we tend to advise patients to have a treatment that moves the teeth, like Invisalign or braces, or a clear aligner treatment to allow the teeth to move into that straight position first. Okay,
and the question that a lot of my patients always ask is, why should I have composite veneer versus ceramic veneer? So let's start with what is ceramic veneers.
Right, so a ceramic veneer is very similar to a contact lens, like I described, but in the majority of cases, in order to fit that veneer onto your tooth, you do require a preparation, so that means the removal of healthy enamel on the front of the tooth generally. And this is because the veneer, when it's manufactured by a dental lab ceramist, they will require to make that veneer a minimum thickness of, let's say, 0.5 of a millimetre to 1 millimetre, so it's extremely thin, But you can imagine if you should stick that on your tooth, it would still be bulky and it would stick out. We don't want a bulky or goofy look. So in order to fit it onto the tooth, we have to reduce the tooth by that dimension. So there is a degree of preparation. So some people don't like that, and especially for our younger patient base, this is something that don't feel comfortable doing because the tooth is healthy, and composite bonding is potentially a better alternative for that particular person in that age range. But someone who may have had fillings already, or maybe have tried composite bonding in the past and is now approaching, let's say, their late 30s or early 40s or even late 50s, maybe the ceramic may be a better option in that particular situation. Now, you mentioned about why composite over ceramic. I think the key thing is looking at the patient. Everyone is unique and we treat everyone bespokely here. So we're looking at their age, we're looking at how healthy their teeth are, we're looking at if they've had any treatment before, we're looking at how aligned their teeth are, we're looking at their desires as well. Because if someone comes in who is, let's say, mid-40s, they've had composite bonding in the past, and they're now looking for that ultimate result, then ceramic may, in theory, be better. But if a young person in their early 30s comes in, they're getting married, and they've got, their wedding's in 2 months' time, and they want to just tweak their teeth, and they want that little bit of a modification, then composite bonding may lend itself better to that particular patient. So it's all based case by case, but generally, if I was to summarise composite bonding versus porcelain veneers, then composite is generally quicker, it's generally a slightly lower lifespan, but it can have the upside of being less cost and it's quicker to place, with the disadvantage of it having around almost half the lifespan of porcelain. Whereas the porcelain has the big advantage of it's being superior in its looks, its aesthetics. It will last longer in terms of its shine, its gloss. It's less likely to stain, and generally speaking, it's more. It's got higher strength properties as it's bonded to the tooth, and therefore we always have to make that fine decision between the two.
Which one looks better?
Actually, if a ceramic veneer is made by a very talented technician and placed excellently by a highly skilled dentist, then that will always beat the composite bonded tooth in terms of aesthetics and function.
That's really interesting. Moving on to kind of replacing, so some older patients have a lot of crowns and they want to improve their smile. What are their options?
Yeah, so if you've already had crowns, bridges or existing porcelain work, then that means your tooth has already likely been filed down and you've got a cover on there, which is the crown or the veneer. So actually, those cases are very simple because you've already got a framework to build around. So in those cases, I've done many of those in the past where we have patients who may have had the metal margin showing around the tooth, so that's where you can smile and your gum has receded and you're seeing like a metal band or a black band around the gum, and that's where your tooth is now showing. A lot of these patients don't like that. They get food trapping around that, so in order to change that, we simply take the old crown off, clean the tooth, and then replace it with a all white crown. And this is something that we commonly do with zirconia, or sometimes with lithium disilicate, which is another material which has high strength but excellent aesthetic properties. So this is very straightforward. It can be as quick as 2 weeks with minimal pain. Usually we do use a bit of local anaesthetic, which is to numb the gum, just so that the patient's not sensitive. And this is a great way to help improve the smile in a minimally invasive way.
I've always loved looking at your cases, and you know that you're very popular on Instagram and you put all your cases for everyone to see, and I love to see your before and afters. What do you enjoy doing the most?
Oh, that's the $1 million question, isn't it? So I think, to be honest with you, it's I can't answer that question because I genuinely actually like everything. I think I get satisfaction from different things. So obviously for the composite bonding cases, you often tend to see patients who get quite a quick turnaround. So they're coming in, they're having whitening for 2 weeks, home whitening kit, and then they're coming in to have their 6 to 8 or 10 teeth composite bonded, and they sit in the chair and they're looking in the mirror, and it's the best feeling to hear and see their reaction, because I'm seeing it for the first time, they're seeing their teeth for the first time, and that's great, and that fills me with a lot of joy, seeing their reaction and seeing how shocked they are, how different they look in a good way. And then I get more satisfaction and different satisfaction from patients who may have been nervous and they're having, let's say, veneer work done because they've just been so anxious about having anything done with their teeth, and someone who's going from a nervous person to someone who's really confident and glowing, that's also just an amazing sight to see, really. So I know I'm not really answering your question because it's so hard to answer. I genuinely get satisfaction from everything that I do. And that's why I genuinely love what I do. It's a blessing to be able to do this day in, day out.
So in terms of kind of the technology, what technology do you use to improve that look? And in addition to that, where do you see the future of the technology with the introduction of AI everywhere now in terms of smile makeovers?
Yeah.
What is kind of the workflow that you kind of use right now, and where do you see things improving?
Yeah, definitely, very good question. We are at the forefront of AI at the moment in this clinic, and we're using we're fully digital now. I'm very confident to say that we're fully digital. So with our smile makeovers, we are planning everything digitally. So we're using the latest iTero Luminous scanner, which is a 3-dimensional scanner to scan the teeth that picks up upon gum inflammation, it picks up on gum, tooth decay, tooth alignment, position, discoloration, calculus, gum disease, all these things. We can then use our digital photography to then implement and embed that over that, creating a render, almost like a simulation of what the new smile will look like. It's fantastic, and this generates the new smile outcome within a couple of minutes. So we're using digital software, we're using digital smile design, we're using our latest 3D scanners, we're using AI in our records, we're using AI with helping with our our workflows to make things slicker for patients and better. We're doing a lot of our Loom, so we're using recording software to help with communicating with our patients, more intimately, but also in more detail, so they feel that the treatment's really, really clear to them. They can review it many times over. Gone were the days where you show the patient the ClinCheck, the Invisalign ClinCheck on TV, and they'd have the 5 to 10 minutes in your appointment to view it. Now we're sending them a detailed video for them to show their friends and family. We're going through every single tooth and other movements one by one so that they can see it, and we're doing that for our smile makeover case as well, where we're overlaying the new smile and giving that to the patient to take home and really explore and be excited about, because it is an exciting journey that we like to deliver. We like to deliver a transaction, not a transactional experience, but a experiential dentistry experience here. So 5 years from now, how will smile makeovers change? Do you think we're going to be replaced by robots? I hope not. I need some work to do. I do think though, robotics will come. Robotics have already been trialled in Asia with robotic implant placements. AI is already being embedded in our clinic with detection for X-ray cavities, cavities on X-ray, sorry. And I'm very confident that we will pioneer that, and we will be embedding that, because we want to make sure that we can implement the best technology for our patients so we can offer them the best care here.
And what about you? Where do you see yourself in 5 years?
Oh, I wish I had the crystal ball. In 5 years' time, I hope to be doing more and more of the things I love. I hope to be advancing in my skills. I have plans to travel to Los Angeles soon to seek some of the top orthodontists, seek education from them and be mentored by them. I also plan to maybe travel to Europe again to do some more in-depth implant training as well, and maybe embark on my master's program for implantology, and maybe even consider some more education in that direction to ensure that we always, dentistry is constantly evolving, isn't it? So I think we have to stay ahead of the game.
And if I was a patient and there was one thing that I should do to enhance my smile,
Yeah.
the cheapest way possible,
Yeah.
what would that be?
Oh, okay. I would say invest in your oral hygiene products. Invest in a good hygienist, because those skills that you learn, even on that first hygiene appointment, will last you the rest of your life. Utilising a TP brush, understanding what size, how to utilise the floss correctly, understanding that there's different techniques for using the toothbrush and how to clean the gum line as well, and that itself will last. Those lessons will last you for the rest of your life, and that will help to maintain a healthy white smile.
It's amazing. I've really, really enjoyed the second podcast that we've done with Dr. Kalpesh Prajapat. I think you're going to be back, aren't you, in a couple of weeks' time, and we're going to really talk about teeth whitening and a few other treatments that you do.
Yeah, I'd love to talk about teeth whitening, composite bonding, all the types of smile makeovers that we do here. Same-day smile makeover that we offer.
And potentially, will we see you again on ITV?
Oh, I was featured on the Abbey ITV programme. Thanks for that. Who knows? Potentially, I'd love to be featured there.
Is it under wraps at the moment?
Yeah, I can't disclose any information.
Thank you so much, and we look forward to doing another podcast in a couple of weeks' time. Thank you.
Thank you.
Brilliant.